So today we're going to demonstrate shave removal of a mole. And Kara here has a little round mole that she's a little concerned about. I'm guessing it's been changing a little bit. And so first thing we do when we decide to shave off a mole is get a picture of it, because we want to identify where the location is going to be. So it's always very important, because a lot of times if it were to come back atypical or need further treatment, we'd want to be able to identify the location. And believe it or not, oftentimes the body heals so well with something like this, you won't even be able to find it. So next thing we do is we just clean the area with a little alcohol. This minimizes your risk of an infection. And then we're going to numb up the area with a little lidocaine. And the lidocaine will also contain a little epinephrine. And some people say they're allergic to lidocaine. Usually they're just allergic to the epinephrine. And what they mean is that their heart races when they use the epinephrine. So we just pinch the skin a little bit. Now, a lot of people are very afraid that this is going to hurt a lot, but really it should be minimally painful. And you can see we inject very superficially. And most people say it's about a 1 to 2 on a scale of 1 to 10. What do you think, Kara? There are certain areas where it's going to be a little bit more painful. For example, on the nose, it's more painful. On the fingertips, feet, things like that. So then all we do is we bend the blade a little bit. And a lot of people get nervous because they think that I bent the blade, the needle when I put it in their skin. But really, all we're doing is we're bending it so that we can slide it underneath the mole. And what we do is we slide it underneath, and then we just shave it off. You can see I got the mole, and it leaves a minimal dent in the skin. Some people will use razor blades that they curve, and what it does is it actually leaves a much bigger dent in the skin. Then sometimes if there's a lot of bleeding, we'll use an electrocautery device, but in most cases we're able to just use a little bit of dry sol. And dry sol is just a treatment that we use to control the bleeding. So that's all there is for the shave removal. It's a very simple, quick procedure that we do. Now I just want to go over the aftercare instructions for something like this. When we shave either a mole or we shave off a potential cancerous lesion, what we'll do is we'll just do the same thing. We'll shave a small piece. What we do is we clean off the area. Well, what we do is at home, we'll tell the patient to leave the Band-Aid that we put on there alone for 24 hours. After 24 hours, what we want them to do is use a gentle cleanser and soap to clean off the area. Then we apply a little polysporin and put on a Band-Aid. Now, a lot of people think that you should leave an open wound open to scab over. Dermatologists believe that you should actually keep it moist because that aids in the healing process. So what we're doing is we've applied a little polysporin, which is an antibacterial ointment. This will help to minimize the risk of an infection. We put it on there with a Band-Aid. And like I said, we'll have her leave that on for 24 hours. After that, she'll just clean it with soap and water. Now, we do advise against using hydrogen peroxide because hydrogen peroxide actually inhibits the wound healing process. And so on the body, it'll take about 2 to 4 weeks for a spot like this to heal. On the face, it'll take approximately 1 to 2 weeks to heal.